Hello, my name is Max, and today I will be telling you about how scientific professionals are using virtual reality and where it is headed in the future. I know a lot of you think VR is a pretty big idea, right? Well, let me show you just how big it is. 51.1 million. This is the amount of VR headsets sold worldwide in the past 5 years. And a lot of these headsets are for the public, but also lots of these headsets are used by NASA and doctors to do their job successfully. Three ways NASA uses virtual reality is to train astronauts, to exercise while in space, and to help remotely pilot vehicles that are in low gravity environments while in space. NASA trains astronauts for zero gravity environments by having the astronauts wear a VR headset so they see objects floating around them as if they were in space. After this, NASA uses robots to move around objects and the astronaut trainees so they feel like there really is zero gravity. NASA uses VR headsets and stationary bikes to help increase the astronauts' motivation to exercise while in space. They do this by having the astronauts look around them and see the Earth while wearing VR goggles. This increases their motivation to exercise while in space because it tricks the astronauts' brain into thinking they're on Earth. This increases their motivation to exercise while in space because they can look at Earth's scenery rather than staring out into the nothingness of outer space. Four ways doctors use virtual reality is to help train medical students to increase empathy for their patients, to help alleviate their patients' pain, and to treat anxiety and trauma. According to the article How Virtual Reality is Transforming Healthcare, doctors are using virtual reality to explore actual patients' body and brain. Medical students are using virtual reality to practice operating on fake digital bodies because it is much safer to operate on a fake digital patient rather than a real-life patient to operate on. Doctors are also using virtual reality to help simulate the health conditions that patients with dementia, Parkinson's disease, or migraine headaches are experiencing. This motivates the doctors to help the patients because then they know how it feels to be the patient. Doctors are also using virtual reality to help alleviate their patients' pain when they are about to get an operation or they have an injury that causes pain. This is because they often get distracted by digital games. Doctors are also using virtual reality to help treat anxiety and trauma through exposure therapy. This helps the patients face their fears virtually, which actually helps them with their fears in real life. Through self-reports, it was found that virtual reality reduced fear of heights 68% on average. VR and AR is getting more and more advanced as more people are using them. AR, or augmented reality, is when it seems that virtual items are coming into your own home and interacting with you, while VR, or virtual reality, is when it seems that you are in a whole different world from your own. AR headsets such as the Apple Vision Pro are trying to integrate AI into the user's point of view so it identifies whatever you are looking at the second you are looking at it. The danger of this is it might identify people and gather information on people without the person's permission. Let's say you're walking in the streets and for some crazy reason someone else is wearing an AR headset. Then they can look at you and immediately they would know about your entire life without you even knowing. This can be a huge invasion of privacy, but one good part about this AI software on AR headsets is it can keep you from eating anything poisonous because it can identify whatever it is before you even touch it. Whether you're into art, music, or sports, VR and AR will change all of those areas of interest with their new immersive technology and design. There's nothing we or anyone can do to stop the evolution of AR and virtual reality, but we can work to use what we have in the most useful ways possible. For more information on virtual reality, check out my blog.